Hello, my name is Laura Vincent. Today I'll be presenting a workshop titled, How Dense Are You? This question refers to the density of our bones. So, who has bones? Everyone has bones. Who doesn't, right? So bone health is a topic that pertains to all of us. Minerals are incorporated into our bones during childhood, adolescence, and early adulthood. Once we reach 30 years of age, we've achieved peak bone mass. If not enough bone mass is created during this period of time or bone loss occurs later in life, we have an increased risk of developing fragile bones that break easily. The human skeletal system consists of, can you believe this, 206 bones that perform vital functions such as blood cell production, calcium and fat storage, endocrine regulation, support of all muscles to create our frame, provide movement, protect internal organs, all this for our survival. Today we'll discuss various ways to build healthy bones in our quest to slow or even prevent osteoporosis. Here's a picture of normal bone, and this is thinning bone as we age, called osteopenia, and then the degenerating of the bone is osteoporosis. Sadly, this picture reminds me of Swiss cheese. See all the holes in the cheese? So this is exactly what happens to our bones when they develop osteoporosis or low bone density. So when we fall, it's easy to, get a fracture. So what keeps bones healthy? Fortunately, many nutrition and lifestyle habits can help us build strong bones and maintain them as we age. What is osteoporosis? It's weakened bone strength and susceptibility to fracture. Osteoporosis occurs when the bone mass decreases more quickly than the body can replace it, leading to a net loss of bone strength. As a result, bones become fragile, so that even a slight bump or fall can lead to bone fractures. These are also known as fragility fractures. There is no cure for osteoporosis. I forgot to mention, it is considered a silent disease. However, treatment aims at slowing the deterioration of the bone tissue and improving bone density through nutrient-dense, antioxidant-rich diet, weight-bearing exercises, sun exposure for vitamin D synthesis, avoiding low-caloric diets, maintaining a stable, healthy weight, avoiding smoking, alcohol, caffeine, and a high-sodium diet. And our disclaimer is to consult a medical professional for advice. Sticks and stones can break my bones, and so can osteoporosis. Our contents today consist of 7 different categories that we'll review briefly. Signs and symptoms. Typically, people fall and develop fractures, and then we see swelling or bruising over a bone, deformity of an arm or leg, pain in the injured area that gets worse when the area is moved or pressure is applied, an inability to bear weight on the affected foot, ankle, or leg, and loss of function in the injured area. Risk factors include smoking, drinking alcohol, being underweight, and hormonal imbalances in women. Alcohol impedes how vitamin D is used in the body, which can lower how much calcium is taken in, and it also rids the body of magnesium at a higher rate. Too much parathyroid hormone causes calcium loss in the urine at the expense of bone quality. Also, when estrogen levels drop during menopause, osteoblasts are unable to effectively produce bone. And high amounts of proteins, caffeine, and salt in the diet may lower calcium levels in some people. Pathogenesis. How is osteoporosis developed? Well, number 1, failure to achieve peak bone mass by age 30. As people age, bone mass is I'm trying to change this. Bone mass mass is lost faster than it is created. Excessive bone resorption and or decreased bone formation during remodeling, and when bone loss occurs too quickly and or when bone formation occurs too slowly. And here's a diagram. Factors leading to fracture, such as aging and menopause, which leads to increased bone loss, low bone density, low peak bone mass. And then, of course, the propensity to fall is going to lead to fractures, which is going to lead to low bone density and low peak bone mass. We have to prevent the falls. Diagnosis. How dense are you? Well, we can find out through a test called DEXA or DXA. It uses a very small dose of ionizing radiation to produce pictures of the inside of the body to measure bone loss. It is simple, quick, and non-invasive, and the most commonly used standard method for diagnosing osteoporosis. Prevention. Optimum nutrition comes to the rescue. We need to eat more vegetables. You see these foods here that I've listed. Because vegetables are one of the best sources of vitamin C, which stimulates the production of bone-forming cells. And they seem to increase bone density. By the way, remember, bone density is measured by the amount of calcium and other minerals found in our bones. So the goal is to have a diet rich in these minerals so we can try to prevent osteoporosis. A high intake of green and yellow vegetables has been linked to increased bone mineralization. A study in women over age 50 found those who consumed onions most frequently had a 20% lower risk of osteoporosis compared to women who rarely ate the onions. One major factor of osteoporosis in older adults is increased bone turnover, or the process of breaking down and forming new bone. Related to this, in a 3-month study, women who consumed more than 9 servings of broccoli, cabbage, parsley, or other plants high in bone protective antioxidants had a decrease in bone turnover. I just wanted to show you that eating greens is supposed to be one of the best things you can do for bone health. So here is my kale that I eat every day. And absolutely love it. Also, I hang these posters for my family to understand the value of certain foods. For example, today's popular nut milks. A cup of one of those milks will give you 290 milligrams of calcium. Tofu, 100 grams will give you 250 milligrams of calcium. Soybeans, 1 cup will give you 175 milligrams. And white beans, 1 cup will give you 160 milligrams. So the list goes on, but you can see that even broccoli, 1 cup contains 60 milligrams of calcium. And even carrots contain 40 milligrams of calcium. And merely 9 almonds will give you 30 milligrams of calcium. So I think it's important to encourage our family to understand the food values and keep them handy in our refrigerators. Here's a list of foods we should try to avoid. High sodium foods, sugary snacks, colas and caffeinated foods and beverages. Inflammatory foods such as processed meats, processed white flour products, sugary drinks, I already said that, high fructose corn syrup, trans fats, vegetable oils. And eating too much animal protein can leach calcium from the bones. And of course we listed many foods, that flax seeds, even oranges, that are high in calcium content. The tip is to consume less than 500 milligrams of calcium in one meal to optimize calcium absorption, because absorption is improved when the calcium is consumed gradually throughout the day. So how do weight-bearing exercises help promote bone health? Well, exercises that make bones work harder against gravity, such as swimming, tennis, hiking, dancing, climbing, resistance bands, and walking actually help the body grow denser and stronger bones. Over time, and can reduce the risk of osteoporosis. Motion is lotion. Before we leave the subject of exercise, I wanted to mention that exercise increases the amount of bone created during the years of peak bone growth in children and can be extremely beneficial for preventing bone loss in older adults. Studies in older women who performed weight-bearing exercise showed increase in bone mineral density, bone strength, and bone size, as well as reductions in markers of bone turnover and inflammation. Strength training exercise is not only beneficial for increasing muscle mass, it may also help protect against bone loss in younger and older women, including those with osteoporosis, osteopenia, and breast cancer. So, performing weight-bearing and resistance training exercise can help increase bone formation during bone growth and protect bone health in older adults. So, what does that teach us? Rest is rust. Did you know that sedentary behavior has negative effects on bone health? Could we incorporate more resistance exercise into our daily routine? Sedentary behavior switches on the cells that promote bones being resorbed, while switching off the signals to maintain bone strength. Medical guidelines for exercise are a minimum of 5 sessions of bone loading exercise per week, at least 30 minutes duration, plus 2 sessions of resistance exercise for adults age 65 and up. With exercise, balance, coordination, and strength are improved, so falls are less likely. When a person loses balance, he's better able to grab a support and not crash down hard enough to cause a fracture. So couch potatoes, beware of your fragile bones. Management. Too much woman cave time, ladies? Well, we need to get out of our comfort zones and get outside and enjoy the weather. See my son? Here, vitamin D is needed for bone health. It helps take in calcium. Our skin makes vitamin D when spending time in the sun. I understand that the hours between 10 and 2 or 3 are peak, and those are the best times to be exposed to the sun. It's supposed to be the healthier rays, or the less harmful rays. And the darker pigment we are, the more sun that we need. But typically 15 to 20 minutes a day is sufficient. But older adults and people who don't spend time in the sun may have a harder time getting vitamin D. And women need a minimum of about 1,200 international units of vitamin D. The prognosis, vertebral fractures or spinal fractures are the most common osteoporotic fracture and are often caused by routine activities such as bending forward, twisting, and or lifting light objects. And they're also called vertebral compression fractures. They occur in nearly 700,000 patients each year. Broken hips and wrists are linked to osteoporosis are not as frequent as the spinal fractures. Hip fractures, post-operative mortality, is an overall 1-year mortality rate. Just scary. Studies show that delaying surgery after a fracture for just 24 hours increases the chance of complications and death. And after a hip fracture, the most common scenario is death due to pneumonia. And wrist fractures are not as common. So these are the works cited, and the bottom line that I wanted to share with you before we close is that bone health is important at all stages of life. However, having strong bones is something we tend to take for granted, as symptoms often don't appear until bone loss is advanced. Fortunately, there are many nutrition and lifestyle habits that can help build and maintain strong bones, and it's never too early to start. Thank you for listening.